Hello everybody, this is Margareta Harris in WHO Headquarters Geneva, welcoming you to our global press conference on...
Thank you for that question. I thought it was fully answered. The two colleagues who traveled to China, the purpose of their visit was to prepare the conditions for the expert group that will travel to do the study. So the two colleagues who traveled from Geneva to China, they didn't have a plan even to study, to start the study, but rather to develop the terms of reference and to prepare the conditions so that the international group can have its terms of reference and other things it needs to start the study. So I don't know where that information you said came from, but it was not their intention to start the study, and they had no plan to travel to Wuhan. Meaning, basically, when the travel to Wuhan is required is when the study starts based on the terms of reference. And during that time, when the international group the international experts are put together, then of course, naturally, they will travel to Wuhan to start the study. Because it's the basics of inquiries like this to start the study from where the first report came. And the first report of the virus came from Wuhan. So the group, when it starts to study, the international group, it goes to Wuhan and it starts its studies from there. So that's how it will happen. So Mike said about the two phases. So the trip of the two colleagues was to prepare for the two phases. So officially, the study will be started by the international expert group, actually, of course, helping Chinese counterparts. So that's the situation, the preparatory, then the two phases, and I hope the study will proceed as planned. I have seen also some articles, I think, which are wrong, and with some, unfounded whatever information. But this is the whole story around the assessment or the study in the origin of the virus. Thank you.
Thank you very much, Dr. Tedros. I think that is now crystal clear. Dr. Ryan, do you want to add anything? Or I think Dr. Tedros has really covered it.
No, just to supplement that, as part of the preliminary mission, our colleagues did have video conference and communication with an Institute of Virology, and we fully expect, as part of any normal mission to Wuhan, that the local epidemiologic laboratory clinicians and other experts will be fully engaged in the response, and we would expect, as part of a trip to Wuhan, to engage our scientific colleagues and collaborators at the Wuhan Institute of Virology.
Thank you very much, Dr. Ryan.